Hi, my name is Niamh, I'm from Bella Beauty in Ballina, and today I'm going to talk to you about Dermalogica Facemapping. It's a skin analysis system that's used by Dermalogica, which is the #1 professional skincare brand in the world. I'm a skin expert with Dermalogica, and today my model Kelly is going to be sitting here for me and modelling, and we're going to go through the face mapping skin analysis. So face mapping is a zone by zone analysis, 14 different zones of the face, helping to determine a person's skin type, #1, and any skin conditions they may have, #2. That helps us to determine what they should be using for their skin at home to determine the results that they want to get, and also what professional treatments they should be undertaking. So I'm going to start analysing Kelly's skin, starting in zone 1. Typical things you might find on the forehead area in zone 1 and 3 include dehydration lines. If you're pinching the skin here, you might see the vertical lines appear together. That shows that Kelly's skin is dehydrated. Hydration means hydration inside and out, so water, but also inefficient product usage onto the skin. So we can counteract that by using a number of different measures to try and hydrate the skin. Kelly's having a little bit of a breakout up here. She actually had an eyebrow treatment the last day, so that could tend to have caused that breakout for Kelly. Other things you can typically find in the forehead area would include breakouts along the hairline. That can happen or come from not cleansing out your shampoo and conditioner well enough, having a reaction with your shampoo and conditioner, or not cleansing and taking out your cleanser. It tends to be caused by excess oil production in that area as well. Moving down through the skin into zone 2, this is the wine and dine area, representing the liver function. People tend to get breakouts here, congestion, dryness, flakiness, if they've been having a lot of alcohol, food, rich substances. Moving down into the T-zone area, typical things that you'd find into the nose area would include comedones and breakouts, broken capillaries on the side. These can be worsened by the time of year, sinuses, hay fever, or if there's a lot of colds and flus happening. Moving down onto Kelly's cheeks area. So her cheek area is quite clear here, but you can see an awful lot of things that people might suffer from in this area would be open pores. You can also see here down into the ear area that Kelly is quite clear and her skin is quite clear, but some things that you might find here into the back of the jawline would be breakouts if people have had any dental work or any x-rays done recently, and or if they're not taking off their cleanser or their makeup properly, if they're not rinsing it properly, and that's the same on both sides of the cheeks. Also things that you would commonly see on the cheek area would be a small bit of congestion. Congestion tends to happen here from improper product usage, so using something that's got an oil base that is very, very rich into the area, that would be causing congestion there when somebody doesn't necessarily need an oil-based moisturiser cleanser or other products. Broken capillaries are quite common into the cheek area as well. The cheek and nose tend to signify sensitivity and or rosacea. That's becoming much more common. We're probably seeing 1 in every 2 to 3 people coming into the salon with rosacea or sensitivity into the skin and in and around that area. Again, October, November time tends to be a time of year that it flares. Also again around hay fever time, March, April and May. Moving down into the lip area, common things you might see here in and along the lip area would be comedones, or what we call blackheads. If people are using lip balms or Vaselines quite high up into the lip area, things that are non-cosmogenic. Moving down onto the chin area, this tends to be a very clear for hormonal breakout for people. Pustules, which are whiteheads, or comedones, which are blackheads, tend to get worse around this area when people are either ovulating and or when they're having their period. For females, obviously for males, it's the testosterone hormone that's causing that aggravation that's there. Down onto the neckline, you'd find for most clients that come in, they tend to have either fine lines or wrinkles or a lot of dehydration into the neck and the neck and the chest area. That tends to happen because people don't tend to bring their cleanser, their toner, their moisturisers, their products down into that area. So they're not treating them the same way they would with the face, and they tend to maybe use a higher SPF on the face, but they're not taking the same care with their neck and their décolletage and down to the chest area. So you tend to see the signs of kind of anti-aging or aging here a bit earlier. So there are lots of different remedies you can use, or you can use to try and help any of those issues. The main thing that we would use, one of our key tools, is using the Dermalogica Facemapping. It tells us a person's skin type, which there are a number of different skin types. The main ones would be oily skin, dry skin, normal skin, combination and sensitivity. They would be the kind of key 5 that we would find. Then skin conditions that we would commonly see would include comedones, which are blackheads, pustules, which are whiteheads, rosacea and sensitivity into an area, so broken capillaries would signify that. One of the key things for us, there was some research done with the Irish Dermal Institute, was that 80% of people are actually using the incorrect products for their skin type. What's key for us is trying to analyse what a person's skin type is, what is that 5 areas, where do they sit, and then also what kind of skin conditions do they want to remedy on the skin. And that's how we would analyse a person's skin, how we would recommend what products they should be using at home and what professional treatments they should be getting in salon. So I've been Niamh Ryan for Bella Beauty. Thank you very much for listening, and please contact us on www.bellabeauty.ie for any further information. Thank you.